this is Joanne, and I'm going to give some reflection on what you did last week, but before that I want to show you very briefly where I'm sitting every day. This is my room. I'm sharing it with two roommates, but they are out at this moment. And I'm walking to my desk now. We're in the new Helix building, and we have been here only for 2 months, and it's a really nice building. So whenever you come to Wageningen, you can probably see where we work. So this is it. Very briefly. Okay, now I'm getting to the serious bit. So what I'm going to do in this clip is to give you a very short reflection on the work you've done on the assignment Epidemiology in the News. Thank you very much for sharing very nice examples of epidemiological studies, both descriptive and analytical. And I will just briefly go through them and show what you have done. So some of you shared some examples of descriptive studies, and one of them is about children in the UK. There was a study done where they looked at the sugar intake of children, and they found that the sugar intake is still very high and above the guidelines in the UK. Then another study was done on marijuana use in the USA, and they showed a trend over time, also a nice example. And third was also on trends, but this time about people's height in different countries, showing amongst others that the Dutch are being the tallest population worldwide at this moment. So these are very nice examples of descriptive studies that looked at specific persons, places and times, and sometimes time trends. Here you see some nice examples of analytical studies that you found in the news. Analytical studies, as you know, look at exposure and outcome relations, and they answer the question why. Why are things happening? Why are certain health outcomes found? They try to find the factors contributing to that. For example, there is a relation between obesity and various types of cancer reported in the news. Another one looking at relations between reading books and life expectancy, between learning difficulties in children and lack of vitamin D, and between air pollution and brain damage. These are just some examples. And as you may have seen for the analytical studies, but also for the descriptive studies, these the newspaper articles or on the internet do not provide all the information of the original publications. So you need to get back to the original papers to know exactly what was done in the study and what the findings exactly were. So when reading about epidemiological studies in the news, it's important to keep in mind that journalists, they like to share information about controversial topics, because that's what people like to read. And they have a tendency to pick out information from scientific articles that are easy to understand for the general public. So you have to be critical when you're reading these newspapers. At one hand, the general public also gets to know a small part of the research findings, the controversial, the hot items. And of that small part, the nuances are often left out to provide an easy to understand and short article in a newspaper or on the internet. So when you're reading newspapers, be critical and try to find the original source if you really want to know what the study was all about. I want to share one of the contributions by you. Samir shared an interesting article about a study that found that the Zika virus could be spread by patients' tears, so people who are infected could spread the virus through their tears. And the study was conducted among mice who were infected with the virus. And I read some interesting discussions on how through the tears the virus could be spread. But finally Samir wondered whether this study is really an epidemiological study. So that's a question I would like you to think about and discuss about on Feedback Fruits. So thank you for watching this short clip, and good luck this week with a lot of new topics that you will learn about.